with a formal welcome and good morning. Ira Jackson is my name. I'm Dean of the John W. McCormack Graduate School of Policy and Global Studies. We're your host for this event, in part because we have the privilege and the pleasure of having Beth Dugan as a professor in our school. And I'd ask you to join me in thanking Beth for her incredible leadership, energy, indefatigable energy in bringing us all together and conceiving this big idea. We have a motto at the school: to think big, start small, move fast. Beth personifies that. You've all succeeded in achieving the first hurdle of the purpose of this conference, which is navigation and safety. You've navigated your way to our campus safely, which itself is a feat, whether you've come by car or tea or boat or walking or bicycling. I guess we represent all the transportation, infrastructure, legal, policy, mobility, and health issues that we're going to be confronting for the day. And again, we're thrilled that you're here. The chaos around you is the price of progress. As Vicki Kennedy said at the dedication of the Edward M. Kennedy Institute, right outside these windows, which are blocked because we're taping these proceedings. Two months ago, we had President Obama and Vice President Biden at the dedication of the new Edward M. Kennedy Institute for the Study of the United States Senate on our campus, and Vicki Kennedy said that Columbia Point, the area that we inhabit along with the Edward M. Kennedy Institute and the John F. Kennedy Presidential Library, is the place to be. And we are very pleased that you are at Columbia Point and at UMass Boston this morning. We are your public research university, the only public research university in Greater Boston, and we hope that for all of you this won't be your last visit with us. We have a particular interest in this topic. I don't have any expertise. I'm simply the MC and the timekeeper to keep us on track all day. But we do have a particular expertise and interest in senior citizens at my school, and if you'd allow me to just boast a little bit about the people who drive that process. Of course, there was probably no United States senator more deeply associated with issues of senior citizens than Ted Kennedy. John W. McCormack, for whom my school is named, was a member of the Congress for 41 years, Speaker of the House for 10, and helped FDR shape Social Security legislation, which was enacted into law 80 years ago in 1935. And he also was there as Speaker of the House, helping Lyndon Johnson enact both Medicare and Medicaid. As a consequence, perhaps, we have within the John W. McCormack Graduate School a gerontology department, which is a very strong department. It has educated 25% of all the PhDs in gerontology in the world, and a gerontology institute. And a gerontology institute led by Len Fishman. If Len would raise his hand. There you are. Welcome, Len. Our Gerontology Institute, and again, this is shameless promotion, but I'm just so proud of Len and Beth and their colleagues. Our Gerontology Institute houses an Osher Lifelong Learning Institute, which is the largest of its kind in the region and the first with an LGBT caucus. We house a Pension Action Center, which has helped recover $50 million for senior citizens who would have otherwise been defrauded from their pensions, and a Center for Aging and Demography, which, among other things, produces an economic security income index, the only one of its kind in the country. Beth and her colleagues also, in sponsorship with Tufts Health Plan Foundation, produce healthy aging reports for virtually every one of our 351 cities and towns in Massachusetts. So we are all in to your space. And again, we're delighted that you're here. Okay, now back to the script. As you all know, I don't think this is any headline to any of you here. Seniors are the fastest growing segment of our population in the country, and certainly here in Massachusetts. They represent 20% of all hospital stays caused by motor vehicle accidents and 12% of all fatalities. With our senior population growing, living longer, and seeking healthier, more purposeful lives, what can we do to help seniors drive more safely? What can technology, policy, and improvements in healthcare and infrastructure do to better anticipate the mobility needs of our larger and older senior population? This conference, all of you, your attendance, your participation is designed to help address and hopefully begin to answer these questions. We're thrilled that you are here, and we are proud to be your hosts. We're also delighted to be joined by a large number of corporate and public partners. Our principal corporate sponsor is Harvard Pilgrim Healthcare. They are joined by Tufts Health Plan Foundation, Ford Motor Company, AAA, and the Mass Council on Aging, and I'd ask you to join me in thanking all of them. I'd also ask you to acknowledge the Planning Committee and the 22 co-sponsoring public and other sponsoring organizations and agencies, all of whom are in your program book. But those of you on the Planning Committee and representing those 22 organizations, would you stand and please receive our thanks and acknowledgement? Our day begins with 2 or 3 keynote addresses. They will be brief, but they will set the tone and shape the context for our deliberations from the day. If the Chancellor arrives, he'll offer a very charismatic and energetic welcome. He's 6'7" or 8", and with a booming voice, and his enthusiasm and love for our mission just permeates the entire environment. So I hope he'll be joining us. We then have 3 4-part breakout groups. 2 this morning. The 4 areas are infrastructure, policy and law, mobility, and health. There are concurrent sessions in those 4 tracks, twice this morning with a coffee break in between. And magically, walls will separate Ballroom B from Ballroom C, and that will be one of the breakout groups, and just down the hall are the other 2 breakout groups. So we're going to adjourn promptly at 9:15. We'll have a little coffee break. You'll go to one of these 4 tracks. You'll have a coffee break. You'll go back into another track. You'll come back and grab lunch provided by Ford Motor Company. You'll bring it casually back into this open plenary session. We'll have another couple of keynote addresses at lunch. We'll then have a brief break. We'll go into our tracks again for the 3rd time, and then we'll come back for a wrap-up and a call to action featuring Massachusetts Secretary of Transportation Stephanie Pollack. So any questions about the format or the day? And if you're slightly confused, as the dean normally is, just ask one of our volunteers, and they will be more than willing and able to assist you. The day ends, as I mentioned, with a reception where alcoholic beverage will be served. That's rare at a public research university. We thank one of our corporate sponsors for that. I do want to encourage all of you to participate actively in this day. There are some 59 presenters. If I had to read all of their bios, we wouldn't get to hear from them, never mind from all of you. But the point and design of this day is that there are 230 experts in the room. So we're going to hear from some presenters, but we also want to respect and hear the voice of virtually all of you in the room. So please don't let the talking heads dominate all the sessions. Okay, so I guess we're not going to have Keith Motley with us, but if he were here, he would tell you that we're very proud to have you, and that as the capital city's only public research university, we take seriously our mission of not only educating the next generation, but engaging in world-class research and in serving the community in leadership ways. And this is one of those ways, and we're very proud to have you with us. So I think we've now back on track. If Keith comes, we'll let him welcome us and embrace us, but otherwise, I think we'll just get on with the program. He's not coming. Okay, so I think the Board of Higher Education may have grabbed him instead. So we have 3 keynote speakers this morning, beginning with Jessica Cicchino, who is a senior research scientist, the senior research scientist at the Insurance Institute for Highway Safety. As the program states, and I won't be offering these bio introductions on all other 59 presenters, but for the keynoters, Jessica is not only a senior research scientist, she's the Institute's lead researcher on older driver safety and also conducts research on a variety of other highway safety topics, including collision avoidance, technologies, and the safety of pedestrians, bicyclists, child passengers, and motorcyclists. Prior to joining the Institute, Dr. Cicchino was a research psychologist with the National Highway Traffic Safety Administration. She holds a BA from Vassar and a PhD in psychology from Carnegie Mellon. The title of her talk is National Trends in Older Driver Crashes. Please join me in welcoming Jessica Cicchino.
Hi, everyone. I'm happy to be here, and it looks like it's going to be a great session today. So I'm going to start out talking about national trends in older driver crashes, and then the next few talks will go into some more Massachusetts-specific trends. So just to start out with a graph that you're probably mostly familiar with, fatal crash involvements and crash involvements in crashes of all severities are high among teenagers, start to drop into middle age, and then start to rise again, noticeably beginning at around age 70. So I'm going to focus on drivers who are 70 and older today. And so the population of people 70 and older has been rising and is projected to keep on rising. So in 1995, there were about 24 million people in the US who were 70 and older, and by 2010, there were 28 million. There's projected to be about 45 million by 2025. And the percentage of older people who are holding on to their licenses has been increasing. So from 1997 to 2013, the percentage of middle-aged people, 35 to 54, who had a license actually went down a tiny bit, but for older people, it went up, and it went up more with older age. So for drivers who are 80 and older in 1997, a little bit more than half had their license, and in 2013, about 2/3 were holding on to their license. And older people who are driving more miles. So in 1995, 96 to 2008, the average number of miles driven in a year by middle-aged drivers increased by 21%, but for drivers who are 75 and older, it increased by 50% or more. So with all of these increases in the older population and in the amount of driving that they're doing, and with older drivers' higher crash risk, there's been a lot of concern over the years about what this would all mean for the number of older people involved in serious or fatal crashes. And so this gives an example of just some of the media headlines we've seen over the years, talking about the silver tsunami of drivers that are coming, pointing out some specifically horrific crashes involving older drivers. But what ended up happening was the predictions didn't come true. So the number of older driver fatal crash involvements peaked in 1997 and declined through 2009, and from 2009 to 2013 have stayed steady. And we also see a decline in older driver fatal crash rates per mile traveled. And so this is a similar graph to what I showed earlier. It shows older driver shows fatal crash involvements per mile traveled by driver age for 3 different time periods. And so from 1995, 96 through 2008, fatal crash involvements per mile traveled declined 26% for middle-aged drivers, but declined by about half or more for drivers who are 75 and older. And we see the same kind of pattern looking at fatal crash involvements per licensed driver. So this shows fatal crash rates per licensed driver from 1997 to 2013. And you can see that the rates for middle-aged drivers declined by 31%, versus for drivers who are 80 and older declined by 49%. And you can see that these rates declined, again, pretty steadily until about 2008, 2009, and then have been holding off since then. And so there are a variety of factors that could have contributed to this decline in older driver crash rates. Some of them might be related to older drivers' crash risk, and some of them might be related to older drivers' susceptibility to injury when they're involved in a crash. And so we wanted to take a closer look at those two components. And I showed a graph earlier that showed how older drivers, beginning at around age 70, have a higher crash risk. But I also want to point out that older drivers' higher susceptibility to injuries and dying when involved in a crash is even greater than their elevated crash risk. So, for example, for drivers who are 80 and older who are involved in a crash, they're 4 times as likely to die than a driver who's 30 or 40. So that's the primary contributing factor to their higher fatality rates. And so we looked at crash risk defined as crashes per mile traveled and death risk defined as deaths per crash in 1995 through 1998, and looked at how it changed towards 2005 to 2008. And we stopped in 2008 because that's the last year where we had driver mileage available by driver age. And we compared those changes for older drivers to those among middle-aged drivers. And we found that for drivers who were 70 to 74, they experienced modest declines in their relative crash risk and in their relative death risk. But you see a little bit of a different picture for drivers who are 75 and older. So for those drivers, they also experienced modest declines in their relative death risk, but they experienced really big declines in their relative crash risk. So what this means is that for drivers 75 and older, the big decline that we saw in their fatality rates was primarily because of big declines in their overall crash risk. And we also did this same kind of analysis for drivers who are 75 and older by the point of impact to their car in the crash. And so for older drivers involved in frontal impacts, they also saw a modest decline in their relative death risk, but a big decline in their relative crash risk. But for older drivers involved in side impacts, they saw big declines in both their relative crash risk and their relative death risk. So what this means is that for older drivers in side impacts, those crashes have become more survivable for them over time, and that's also influenced how their fatality rate has been going down. And again, I just want to emphasize that even though older drivers' crash risk has decreased, and that's played a big role in how their fatality rates have gone down, it's still older drivers' increased death risk that really contributes to their higher fatality rates. So this graph shows the relative contributions of crash risk and death risk to older drivers' elevated fatality rates. And it shows it in both time periods that we looked at, 1995 to 98 and 2005 to 2008. And for all older age groups, their elevated fatality rates or their elevated death risk is what really makes the difference. So for example, for drivers who are 80 and older in 2005 to 2008, they were 4 times as likely to die when involved in a crash, but twice as likely to be involved in a crash per mile traveled. So their death risk contributed about 2/3 to their higher fatality rate. And so just to sum up, fatal crash involvements both per mile traveled and per licensed driver have declined more among drivers 70 and older than among middle-aged drivers, although these rates are starting to slow down now. And the declines for drivers who are 75 and older were due mainly to decreases in their crash risk. And there's a lot of things that could have contributed to this, and we don't know exactly what it was, but some possibilities include better health of the older population, which might be reflected in the increased mileage that we saw for older people. We might have now fewer low mileage drivers who have impairments that were increasing their crash risk. Some other things that might contribute might be improvements in roadway design. We know the Federal Highway Administration, for example, put out recommendations, design guidelines for older drivers in the late 90s, and that many states have implemented some of those, and those could have made a difference in crash risk. And then we also saw that there were big declines in relative death risk for older drivers in side impact crashes. And some of the things that might have helped there include side airbags that have become more prevalent, or prevalent at all really, since the late 90s. There is evidence that side airbags are particularly effective for older vehicle occupants. And another thing that might have played a difference might have been improvements in passenger vehicle incompatibility. So older drivers are more likely to drive lighter passenger cars as opposed to larger, heavier SUVs. And those generally, historically had a disadvantage if they were in a crash with one of those bigger, larger vehicles, especially in side impacts. But this incompatibility between vehicles has been improved over the years and might have also been improving older drivers' survivability in those side impact crashes. Thank you.
In a previous life, I was dean of the Peter Drucker School of Management at the Claremont Colleges, and one day in my office, I got a call from the California Registrar of Motor Vehicles, and he said, Doris Drucker, 98 years old, is at one of our registry offices seeking a renewal for her license permit. What should I do, Dean? Do you know her well? This is Peter's widow. And I told the registrar that the previous weekend, Doris and I had gone hiking up Mount Baldy, which is 11,200 feet, and she smoked me to the summit. So he gave her a license renewal. I think seniors are getting healthier. That's the good news and the moral of that story. Jeanne Hathaway is the injury epidemiologist at the Massachusetts Department of Public Health, an expert in injury prevention. Over the past 4 years, she's been the point person for motor vehicle-related injury data at MDPH. In addition to her work with motor vehicle-related injury data, she's helped develop statewide reports on traumatic brain injury, fall injuries among older adults, and overall injuries among Massachusetts residents. Dr. Hathaway received her MD from the University of Massachusetts Medical School and her MPH from the University of California, Berkeley School of Public Health. Please join me in welcoming Dr. Jeanne Hathaway.
Thank you very much. It's an honor to be here, and I want to thank Jessica for setting the national context for older driver injuries. I have been asked to speak about injuries to Massachusetts drivers ages 65 and over. So I'm going to present that state data. And I first want to thank my colleagues from the Injury Surveillance Program at the Massachusetts Department of Public Health, Beth Hume and Holly Hackman. And I also want to thank Taeman Lee, who's a graduate student here at UMass Boston, for helping me with the mapping data that you will see. Just to go over what I'm going to present to you, first I'm going to show the trends in terms of 4 different age groups compared with older drivers. There'll be a little different age groups than Jessica's. And I will look at fatalities using the FARS data, the Fatality Analysis Reporting System. Hospital stays will be non-fatal data, which combines hospital discharge and observation stay data. We'll look at emergency department visits, and these will all be based on rates of licensed Massachusetts drivers. And then for the last part, I will focus just on the Massachusetts residents 65 and over. We'll look at the annual burden of injuries to drivers. We'll look at some indicators of severity, some of the serious kinds of injuries that are sustained, and what percentage of the hospitalizations need rehab and additional care. We'll look at costs in terms of hospital charges. We'll look briefly at how injury rates vary across the state. And then I'll end with a little comparison by 5-year age groups, although Jessica touched on that. So to begin with, I'll just give you a little orientation to my charts are laid out a little differently than some of Jessica's. So across the bottom is years. I looked at 2002 to 2013 because our emergency department data only goes back to 2002. Then we have the 4 age groups. I have grouped all Mass residents 65 and over in the red bar compared to the 3 other age groups. And as I said, this is all rates per licensed driver. We used data from the RMV on active people with active licenses. So as you can see, the rates for our youngest drivers, 16 to 24, has gone down considerably, and rates for drivers 65 and over is the second highest for fatality rates. When we crunch the numbers, we see that for younger drivers, the rates have gone down by a little over 5% per year, which is fantastic. The numbers for the older drivers has kind of bounced up and down, and because the numbers are smaller, it doesn't show a significant change, but it's a 2% decrease per year, but it's not statistically significant because it's kind of bounced around. It's thought that the graduated driver's licensing law of 2007, as well as probably the recession, are part of what contributed to the drop among the younger drivers. For hospital stays, again, we see a drop in, I want to mention that this is non-fatal data. We are able to include deaths in hospital stays, but for this analysis, I just looked at the non-fatal data. Again, older driver motor vehicle crash data is second highest for the 65 and over residents, although as you can see in 2013, the rates are virtually identical with the drivers ages 16 to 24, and if the trends are to continue on these trajectories, the drivers ages 65 and over will have the highest hospital stay rates for crash injuries. And here are the percentage decrease. So for the older drivers, it's almost 3.5% per year is the average annual decrease. So slow but steady. I didn't want to put all the numbers up there for all the age groups, but there's sort of similar percent decreases in the middle age groups. And this suggests that systemic changes, as Jessica mentioned, safer roads, safer cars are probably contributing to these decreases. For ED visits, interestingly, the older drivers have the lowest rates per licensed driver for ED rates. And it's a little hard to tell, are these decreasing or not, because they're all going in parallel. But in fact, all of these rates, when we crunch the numbers, show that they are statistically significant in decrease. And the rate of decrease for the older drivers is similar as to hospital stays, a little over 3% per year during this time period. So now we'll move on to just focusing on the older drivers. So in terms of annual numbers, in 2013, unfortunately, is the most recent data we have, there were 42 deaths, 446 hospital stays, and about 3,000 emergency department visits. And this number of deaths may be different than some data you see from DOT because they sometimes include older driver occupants or older drivers involved in fatal crashes who did not die themselves. So that's why this number may be a little different from other numbers you've seen. Interestingly, these numbers have the counts, the overall number of older adults injured in car crashes in the state has remained pretty constant over the last 10 years. Because although the rates have been going down slightly, the 3.5% per year for hospital stays and ED visits, the Massachusetts population of adults 65 and over has gone up 16%. Not huge, but it was creeping up 16% during this time period, 2002 to 2013. And we seem to have a higher rate of hanging on to our licenses, but that's gone up too. So in 2002, 79% of the population 65 and over had their license, and in 2013, it was 84%. So trends going down, population going up, more drivers, the actual numbers are staying the same. I wanted to give you a sense for the severity of these injuries. So I looked at the hospital data and I included the deaths in the next few slides. And I also grouped the last 5 years of data, 2009 to 2013, in order to sort of get a more stable rates for the percentages. So as you can see, there's a lot of severe injuries. Obviously, people could have multiple injuries, not just one group. So over 1 in 5 of the older adults hospitalized for a crash injury has a traumatic brain injury. Over 1 in 5 has a vertebral column or a vertebral or spinal cord injury. Although I looked at these are mainly vertebral fractures. So they're at risk for paralysis, but fortunately, hopefully not going to be paralyzed. Internal abdominal injuries, it's also 1 in 5, and these injuries were mostly pneumothorax and cardiac injuries, cardiac contusions. 40% rib, sternal, like torso fractures. These are mainly chest fractures. So as we can see, the chest, the head, those are the primary severe injuries. And of course, there are also the limb fractures. Something else. Oh, yes. Surprisingly, the median length of stay for these, this group is 4 days in the hospital. And it's 4 days whether you're 65 to 69 or 85 and over. So what happens to you after those 4 days? Well, over half are transferred to a rehab or skilled nursing facility. So this is a good reminder that our hospital data, although that's largely what I have here to show you, is only a piece of the picture. An additional 12% are sent home with additional nursing care services. I should have added that, not just any old services. And only 1 in 4 are discharged home without services. So unfortunately, we don't have good data on the length of stay in the additional care facilities or long-term outcomes, such as how traumatic brain injury affects folks long-term. That, unfortunately, is something we need to work on. Shall I go really fast? Okay. Hopefully you can get access to these slides. I present hospital charges. The hospitalization charges are the main contributors, and the overall cost is $28.5 million per year, and that's not including the rehabs and the outpatient care and the lost wages. The rates across the state don't actually differ that much. We have different colors, but the it's really just a small difference. So as in it's 30 per 10,000 drivers versus 50 per 10,000 drivers. We can talk about that later. And I did just want to mention in the for the groups of 5-year age groups for older adults, when we take into account the fact that not only did the number of people licensed drop by half, but their vehicles miles travels dropped by over half, that the injury rates, although they substantially increase when you look at rates by active driver, it's even more dramatic when you factor in the vehicle miles traveled. Interestingly, for ED, the rate doesn't seem to increase in the older age groups until you factor in the vehicle miles traveled. Older adults are lessening their exposure by driving less, but if you look at for the mile traveled, those 80 and over are at very high risk. So thank you very much, and I welcome questions by email or after the presentation.
You can read all about this fantastic professor of mine, Beth Dugan, in your program book. I just want to say that she's the spark and the energy behind lots of good things with our students and our research, and certainly this conference. Please join me in welcoming Professor Beth Dugan.
Good morning. I am so happy. I go on vacation tomorrow. But what makes me even happier than that is that we have a room full of experts and innovators, service providers, and leaders to help make Massachusetts a safer place. So thank you for your participation, and thank you for your interest in this topic. So my talk is about the vision. Older driver safety is attainable. And here's a shot of our beautiful Seaside campus, and we have lots of gerontology programs and a certificate in transportation, so we have lots of educational offerings that we hope will be of interest to you. So that's my paid commercial announcement. I want to thank the other presenters. What a great job. We have the national context presented by Jessica, who truly is tops in the field in terms of national data. Jeanne, thank you for presenting the injury data and giving us the Massachusetts picture. We are so lucky to have the cast of speakers and presenters and attendees, so thank you. You may not realize it, but we're living in the midst of an unprecedented demographic shift. Never before in human history have most people in developed countries been able to expect to live to old age. This is a dramatic transformation. It's akin to learning to walk upright, to the discovery of fire, to the discovery of penicillin, to landing on the moon. You name it. This is that kind of change that we're living in. Just compared to people born in 1900, we experienced an extra 30 years of life. That's almost a lifetime, a double lifetime that we have. In the US, 10,000 adults turn 65 every day, and this trend will continue. In Massachusetts, in less than 15 years, more than 22% of the state will be age 65 or older. All of that is great news. The bad news is we aren't ready yet. This is such a new shift that we haven't adjusted to capture all the skills and value of the older adults or to provide the services that people need when they're less able to function. So what's called for is a basic re-engineering of society to become more age-friendly. And this is the World Health Organization model of age-friendly communities. And you can see the transportation is a key component of that. So it's not just that we have gains in human longevity, but we want to add, it's not just adding years to life. So now we live to 85, and before we would die at 47, but we have quality years of life to enjoy. This map shows the percentage of the population in Massachusetts that's age 65 years and older. And this is work that we did in partnership with the Tufts Health Plan Foundation for the Healthy Aging Data Report. And so with darker colors showing a higher percentage of people 65 and older and lighter colors showing less, you look at the map and where do you see the high concentrations of older adults? Cape and the Berkshires, 2 retirement destinations. Very good. There is a test in the evaluation that you'll get tomorrow. And then when you look at the distribution of people across the state with active driver's license, you can see 1 dot equals 100 people age 65 and older with an active license. And here, where do you see the concentration of older drivers? The high population centers, so Boston, Worcester, Springfield. This is similar to the research that you just saw, but basically if you look at the red line that's showing the fatal and serious accidents, you see a general downward trend over time in fatal accidents. And this is another way to look at it, just the gestalt. If you see the green, which is the less severe accidents, and moving up the bars are more severe, and this is over time, you can see the green is moving up and the other colors are moving down. But it's not all good news. There are places across the state where older adults are overrepresented in crashes. And so here you can see the dark areas indicate places where older adults are overrepresented in crashes. And with this map, I want to thank Che-Man Lee, my graduate assistant, and Bonnie Poland for their creativity and GIS wizardry. So I had a great op-ed that didn't run in the Globe today, but I'll tell you the punchlines, and then I won't feel so bitter. I talked about us convening this summit of experts and innovators asking questions and providing solutions to make Massachusetts safer for people of all ages. And some of the solutions are obvious, right? We have good data. We know that left-hand turns are tricky, that older drivers sometimes have difficulty turning across multiple lanes of traffic, judging the distance and the speed of oncoming traffic. And those left-hand turns result in side impact crashes that are particularly deadly. So we could do better with left-hand turns. Now, side airbags have helped a lot, and Jessica's data showed that. But we could do better in terms of designing intersections to have protected turns. We could train older drivers to route plan so that those types of turns were minimized. We could do better in offering better options to people who don't drive. So in many areas of the state, the only option is to keep driving, even when your driving fitness is compromised. There aren't sufficient services available to get someone around from point A to point B when they want to get there and they need to get there easily. And so where is the senior Uber type of service when a person could just touch their smartphone, get a ride, and if they need assistance from the vehicle to the destination, the driver would be ready and willing to provide that. We need policy best practices. Now, in 2009 and 2010, thanks to the leadership of participants in this summit, we now have some of the best practices in place. We have in-person renewal for older drivers, we've improved the medical reporting system, and we have a cognitive guideline to help community doctors understand what and when to report a driver. All of those are great steps, but we can do better, and we have to keep our attention on the policy best practices. And finally, we have some exciting keynotes. I can't wait till the lunch keynotes when we have Ron Medford from Google talking to us about their work with the driverless cars, when we have Joe Coughlin, who is a truly visionary person who will be able to forecast the future and help us make sense of what technology may offer in terms of continued mobility. But new safety technology will only go so far if only 1% of the population can afford it. And so we've got to continue to keep the price point accessible for us to yield the benefit of this. So don't you think the Globe should have run that? But that's not enough. This is what we call, on the planning committee, a think and do tank. We want you to provide your ideas and solutions. So in the question and answer, in the follow-up, in your interactions at coffee breaks, at lunch, in the networking session, give us your ideas, because it's only by working together we'll make real progress. And so while it's true there is no free lunch, we want you to work for your supper, so to speak. The point is so that we can distill your expertise and your ideas into a plan that will reduce fatal crashes in Massachusetts involving drivers 65 and older in the next 5 years, starting today. So keep an eye out for the Summit Highlights report. Is Steve Braun present? Steve is a wonderful medical and science writer who's going to compile and synthesize the proceedings today into a report that will be engaging, informative, and inspiring. So keep your eyes open for that. If Steve contacts you for follow-up or clarification, please help him. He's legit. He's not trying to sell you anything. He's just trying to help make Massachusetts safer. In addition, keep your eye on the website. We will be umb.edu/older driver safety. We'll have the proceedings, the materials, and hopefully an ongoing interaction available through it. So sometimes don't you feel like Sisyphus? It's like, oh, we're pushing the rock up the hill and not making any progress, and pushing and pushing. But maybe we're approaching the tipping point. Maybe the fact that we have more than 230 people willing to shell out good money to talk about older driver safety, to work together to make this happen. Maybe today will be the day that we cross the tipping point and start to have the snowball effect moving Massachusetts towards an age-friendly development. So together we can make Massachusetts age-friendly by improving older driver safety. And Massachusetts, in turn, can be a model for the nation. Thank you.